Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark. Guys, I am here with my good friend, Dr. Peter Weinstein, and we are talking about the question of, should veterinary support staff be paid on some sort of a production model like a lot of veterinarians are? What are the benefits? What are the drawbacks? Is that the future for vet medicine? Would that motivate a change in behaviors? Would it show appreciation to our support staff? Would it help us keep technicians, assistants, front desk people, kennel techs? Would it help us keep them in the profession longer? Anyway, this is a great idea discussion. We kind of sprawl all over the place. I really hope you guys will enjoy it. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Dr. Peter Weinstein. Thanks for being here.
Dr. Roark, always a pleasure to be with you, my son.
My son. Peter, what advice do you have for me? It's funny. Whenever I should start blocking more time on my schedule to do our podcast, because we talk for hours around the podcast that we actually record. And you've had a sprawling conversation about the profession so far and what the future looks like. And I think we sort of naturally in our conversation came to what I want to talk to you about today. But first, let me say, for those who don't know you, you are a failed retiree. You really have not retired very well at all. You are an entrepreneur coach. You're an educator and advocate for the vet profession. You have worn many, many hats. You were just running the practice management program at the AVMA convention when I saw you last. You just do many, many things. And you are one of the main people that I go to when I start thinking about the future and looking in my crystal ball and kind of trying to figure out, where's this crazy profession going? And you and I have a lot of philosophies that line up really well, and we care about a lot of the same things. And so I came to you recently, and I was sort of saying, hey, look, Peter, we're looking at changes in profession. We've got corporatization. We've got a lot of private equity things coming in. I'm looking at a push to raise the salaries of our support staff, especially. We know that that's a big factor of stress for our staff members. And I was trying to talk about, how do we do this? Like, how do we make life better for our support staff? How do we pay them better? And so you and I have gone back and forth. We've had different conversations about production-based pay. We've talked about how we pay doctors. And I'm always kind of interested in how those things sort of come together in your mind. And so the question that you and I have sort of kicked around, and you sort of posed this question to me, is, does production-based pay in veterinary medicine accurately or adequately recognize and reward the support staff who are doing the work that gets the patient taken care of? And so I want to go ahead and start to unpack this, because you and I have talked before about production-based pay for veterinarians. I've had a number of guests on the podcast talking about the benefits and then the drawbacks, and also, like, is this the culture that we want to foster in our profession? So I'm fairly neutral on production-based pay, but I'm definitely open to change. I am very interested in growing the income of our support staff and keeping them in our profession longer and making this a more attractive profession for people to be in. So let me sort of bring that to a close and sort of stop talking there. Yes or no, our current system of production-based compensation for most veterinarians totally takes care of support staff in an adequate way. Do you believe it?
No. I think production-based pay rewards the doctor for the services that they feel the pet has needed. However, the individuals who, in many, many, many cases, actually deliver those services are the healthcare team.
Mm-hmm.
So the doctor gets rewarded by salary, and in many cases, a percentage of what they put on the healthcare plan, treatment plan, estimate, whatever you want to call it. They hand it off for somebody else to do the work, who is paid a salary. So no matter how hard they work per hour or don't work, they're going to get paid the same amount.
Right.
But in many ways, the doctor keeps pushing the work. They keep making more money as the doctor, but the staff isn't recognized for how much work they're doing. And that's why I think that there's a disconnect. And if we're going to look at team-based healthcare delivery, where everybody is working together, from the person who answers the phone. Oh, and by the way, doctors who are on production, you don't see clients unless somebody makes those appointments. Oh, by the way, doctors who are on production, you can't see more people if you're the one in the treatment area taking radiographs, pulling blood samples, and putting in catheters. Oh, and by the way, doctor, you're not the one cleaning the cage for that pet that was in the cage, but you are the one getting paid for all those services that you do. So that's why I think there's a disconnect we have to figure out a way that rewards everybody on the team for all the work that the team does in a collaborative fashion.
Is this idea, are you looking at this, if we could magic wand, make it so that the revenue of the hospital went to the team based on how much they did or how much, what they generated, that would come back in sort of almost like a profit sharing. Are you imagining that as the team should be rewarded, or are you willing to go a step further? I have long maintained, this is one of my sort of core values is work ethic. I like working with people who work hard, and I like to work hard. We have set up a lot of pay scales in vet practices, which I think are generally a good thing, but they're almost entirely, the ones that I've seen, built on skill acquisition or knowledge acquisition. The pay scales are not generally, they don't reflect this person busts her hump and takes back twice as many patients in a day as the average, say technician in our practice does. And I would say, this person might not be the most technically skilled person in your practice, but she has her hands on way more pets than any of your other technicians. And I think those truths are often unrecognized in practice. Do you agree with that?
Absolutely. But what you're talking about is a subjective measure, and we are an objective profession. In other words, we can measure. Now, unless we start to measure the number of animals that an individual team member touches, then we're making a judgment that says, well, they're working harder than anybody else. Maybe they should make more money. And then somebody complains and says, why are they making more money? So what we're dealing with as well is an environment that's somewhat competitive at all levels. And how do we create an objective measure of how hard people are working?
Yeah. I mean, yeah, I agree with that. And I think that it gets tricky when you say, well, we've got one technician in the lab and we have one technician at the treatment room tech, and their names don't really get put onto cases. I definitely get that. I have always thought that there was great value in recognizing, say, the technicians who are doing more senior blood work than the other technicians. And maybe that's because the doctor they're working with is better at recommending senior blood work. But I'm finding more and more that's not really true. When we have well-leveraged technicians and they know what the plan is and they know what our wellness protocols are, they're in there talking about heartworm testing, senior blood work. They're talking about, in some cases, they're talking about dentistry. They're talking about a lot of services that can be objectively measured. I think it's a little bit challenging to tie those services to the individual technician or support staff, but that's kind of my holy grail, I think, Peter, is I really would, the way we track services for doctors, I would love to try to figure out some way, and it's going to be sloppy because of how the team works together. I really think that there's great value in that. I think that there are some support staff members who just absolutely crush it, and I think that they could share best practices with the rest of the team. And also I think they should be compensated for their skills and their effort in a way that I don't think we've done that very well so far.
Well, let's put it this way. When you, as the Dr. Roark, schedule my pet, Bruce, for a dentistry, the invoice gets processed the end of the day, and everything on the line items associated with that dentistry goes to Dr. Roark. In most cases.
Yep.
But Dr. Roark never touched the teeth except to check and make sure that they were clean.
Yeah, I looked at them.
Yes, but you didn't touch them. So what if that invoice said your dental hygienist today was Susie? Her assistant today was Judy. And the animal caretaker who took care of your pet's cage was Jane. We are not giving, oh, and by the way, your receptionist today was Crystal. We're not using our invoices to identify and recognize the team for the work that they're doing.
Yeah.
And I would suggest that every dentistry should be linked to probably a credentialed technician and an assistant. Every surgery should be linked to a credentialed technician, an assistant, and a doctor, because I think it's time to start recognizing them in the same way that we have started to do more and more quote unquote tech exams, but does it give credit to the technician by name who did the tech exam? So now we're going to make it even more complex, and we have a hard enough time getting invoices right in veterinary medicine, and especially if you're on production-based pay where every line item could determine what your paycheck is. Think about now we have to give a credit to the technicians. Now, I'm not taking away from the doctor, but I am wanting to give credit to the technician who was tasked to do the work. And we have to leverage it. I think, you're talking about giving more credit to the techs. I think we need to give more credit to the CSRs because they're the ones who are making the appointments, and they're the ones who in many cases, checking clients out. And they're the ones in many cases who are dealing with the really difficult clients from an emotional standpoint.
Well,
it's a team-based effort. We can't get the rowboat down the lake unless everybody is stroking at the same cadence.
Yeah, I completely agree with that. Hey guys, National Veterinary Technician Week is coming at you. And if you're someone who wants to do something nice for your technicians and you haven't thought about what yet, don't worry, I got you, but you need to act now. My new card game, Dr. Know-It-All, is out. This is a veterinary-specific card game. It is vet trivia. It is fun for the whole team. You can play it with the whole team. It is fast. It is funny. You will have a really great time. Anyway, it is geared up here, ready. I've got it at my house. I will send it directly to you or to your practice. All you gotta do is buy a copy. I'll put a link in the show notes. Head over to DrAndyRoark.com. Grab a copy for everybody. This is something that the techs are going to really love. The trivia questions are meant to be at the level of the veterinary technician licensing exam. And so they are a little bit spicy in their questioning. We have a hard mode that you can use with the doctors. We can make this much more challenging. We can also make it much more easy if you're onboarding new people and they're new to vet medicine and they just want to learn. So anyway, got you covered from an education standpoint, got you covered from a fun standpoint, got you covered from a gift standpoint. Really, I think I got you covered all the ways. All you got to do is get yourself a copy of Dr. Know-It-All and get it wrapped up for the technician that you want to say thank you to. Anyway, that's what I got. Link in the show notes. Let's get back into this episode. I have been a big proponent for a long time. I think the front desk is the most underrated position in the practice, and I have for a long time. That's not to take anything away from anybody, but because they're up front, most of us don't see them and think about them and what they deal with, and so I don't think that they get necessarily the recognition they should. I had this thought, and I'm just curious if you're going to bite on this. We was at the AVMA convention, and we were in Austin, Texas, and I went up to a restaurant, and I ordered myself, like on the screen. I put in my phone number, I punched in my order. And then after I had ordered self-checkout on the screen, it then asked me for a tip. It asked me if I would like to tip. And I mean, I swiped my own credit card. I did the whole thing. And I just kind of looked at it like, I guess this is where we are in that I am not tipping. And first of all, it asked me for a tip before I got my food. It wasn't even like, didn't you like your food? Would you like to tip? And I just thought, this strange idea of tipping has become so ubiquitous. I mentioned it. I wrote an article and said, are we ready for tipping? And I got a lot of flack for even, asking the question of whether or not Vet Medicine was ready for this. Would you be open to tipping the staff at a vet clinic, or do you think that's totally gauche?
I would not be adverse to tipping the staff at a vet clinic if it is done by the leadership, management, and ownership of the clinic, which of course doesn't make it a tip.
Yeah, that's not a tip. That's a bonus.
Yes. I would have a problem somebody individually giving a tip to the technician who did the prophy, for example.
Sure, I agree.
And I think we've seen tipping, quote unquote, occur when house calls are made or other things and probably not even being reported. In those situations where everything is pretty much automated and you get that request for a tip, the reason I might give a low-end tip, maybe not the 20% I normally give, but 12 to 15%, is because there is still somebody putting the coffee in the cup, putting the lid on the coffee cup, making the latte, and doing the work there. Now, whether that gets bundled into the cost of the coffee, I don't know.
Yeah.
In many restaurants, the tips are all brought together so that the busboys who do the heavy lifting, the busboys in a restaurant are the equivalent to the technicians in many cases. Now, maybe they're the assistants because the waiters and waitresses would probably be the technicians. But then who's the doctor? Anyhow, the chef would be the doctor.
Okay.
And then you have sous chefs who are doing a lot of the line work that you never get credit for. I mean, the Chef Ramsay gets all the attention, but who's actually doing all the work?
No, I like it. I think that I'm not even advocating. I like to bring it up. I'm just, when I see tipping like that, it just, in my mind, it's interesting. Clearly, this is a strategy that other businesses and other industries have employed to try to increase the income of people who are working there without raising the actual prices. And so I think that's why it pops into my mind. I don't know that I feel good about it. I think it's probably lots of ways it can go badly. But as we start to talk about recognizing the team, things like that, it occurs to me that is something that we see in other industries. And I like your analogy too of the way, my understanding is the way those tips work is they go into a pool and it gets split amongst the people who are there. And I think that that's a fair way of kind of compensating across the board. Again, I don't know that we're ready for tips or that we want that, but it's just, you should always be looking at other industries and sort of seeing what they do.
I'm sitting here, and you know I'm in Los Angeles, and I'm sitting here and I'm thinking, of all the plastic surgeons in LA, do you think that they get a tip for doing a perfect nose job? Do you think they get a tip for, we don't tip in human healthcare in most cases, even if it's the elective procedures. We don't tip our dentists. And I mean, as much as, and I've said this before and I'll say it again, as much as veterinary medicine is a service industry that provides healthcare, we don't tip on the healthcare side of things. It just seems to be it just doesn't fit in being a healthcare professional from that standpoint. On the other hand, you all read All Creatures Great and Small, and let's just say that James Herriot got tipped with bacon and eggs and sides of beef, but that was a different era.
Yeah.
And so it's really, I mean, if you want to look at tipping, it goes back to something you superficially talked about earlier, which is profit sharing.
Yeah.
And I really do think that's in a sense, essentially that's what production-based pay is. But let's look at profit sharing for the entire team and not just for the doctors, although the doctors do deserve to be rewarded for the work that they do. We can't do this if we don't have a team to support us. We cannot make as much money for the practice without a team to support us. And unless the doctors start to take some of their production-based pay and give it to their team, hey, Andy, you want to give some of your production-based to your team?
I mean...
Put you in a corner there.
Yeah. Ooh. Yeah, no, I think that's the question that comes into everybody's mind, right? Is we say, well, we should pay the team on production, and then the doctors kind of go, well, I'm not interested in giving up what I'm earning, and this is how I'm getting paid. And again, I think that's I don't think anyone expects that level of altruism from the average veterinarian across the board of let me reduce my salary and hand it over to the support staff. I think that'd be a lovely thing. But we also know from the Merck 2023 well-being study that student debt is one of the main stressors, especially for young vets. And so people have got they've got their own sort of burdens that they're carrying.
Well, and again, ladies and gentlemen, veterinary medicine, although you may think it's a not-for-profit business, is a for-profit business.
Yeah.
50% of the hospitals out there probably aren't making a profit when it comes down to it, but we're a for-profit business. which means theoretically, we should have a budget. Theoretically, we should be looking at the numbers from which that budget feeds, whether it's income or whether it's expense. And when it's all is said and done, as the practice does better, the team that helps the practice do better, if you are an above board owner, will turn around and say, thank you for helping us get us to where we are. Mm-hmm. Because that profit, let's just say we're at a really nice number of 20% profit. What if we took 2% of that profit? So as the owner, I only got 18%. And let's say that's $2 million. Now, Andy, get your abacus out and tell me what 2% of $2 million is.
Fast math.
So $40,000. What if we took that amongst our team of 20 and spread it out in some fashion that represents both subjective and objective work, and maybe longevity? And if one member of that team got $1,000, maybe even a quarter, or at the end of the year, maybe they got $250 a quarter. How big would that be for somebody who's only making $18 an hour?
Yeah.
I mean, you think about the motivation there. That doesn't necessarily impact the doctors because they're still doing production based upon their budget and everything else. It's really looking at an owner and saying, I want to keep my team. I want to recognize my team, those who work hard, and I want to reward them for the work that they're doing.
Yeah. You know, I've heard of practices talk about this a number of times, and I've talked to practices about profit sharing and things in the past. And I think that you're probably onto something. I like the way you're looking at it as a way of rewarding and showing appreciation. I think that a lot of people in vet medicine have tried this as a motivational tool, and generally it doesn't work that well to motivate. You know, they say, oh, we're going to do a profit share. I think people very much appreciate it, but I don't think a lot of our support staff they're not super money motivated driven, or the frequency that we're making sort of payouts and things like that doesn't click the box for them the way that people sometimes think that it will. And so I like this as a way of rewarding and showing appreciation. I think that makes a lot of sense.
Here it is in a nutshell, for lack of a cliche. If we run our businesses so that passion drives profit, we will have a successful business. But if we run our businesses where profit tries to motivate passion, you'll fall on your face.
Yeah, I think you're spot on. I think that's a really good way to summarize what I have seen with profit sharing. That totally makes sense.
Keep the passion, because passion is really, and maybe it's overused, maybe it's trite, but we're not in this field. You know, Andy, do a survey sometime of your followers and see how many people enter veterinary medicine to get rich.
Right.
You know, we're in it because we have a focus, we have a direction, we have a desire to make a difference. That's passion. And reward passion. And I think we'll all be in a much better position.
No, I agree. Dr. Peter Weinstein, thanks so much for being here. Where can people find you online? Tell us a little bit about your entrepreneurship program that you're doing right now.
Thank you, Andy. We just released a program that's focused on helping create the next generation of veterinary entrepreneurs. You can find that at www.veterinaryownship.advocates.com. And it's an online course. We have 24 hours of race-approved CE with a monthly, what we call a mastermind call, to talk about how you can be successful, the problems that you're having in running your practice. And so we're really hoping to build a community of entrepreneurs to keep veterinary medicine independent and to build this next generation of hospital owners. So that's one of my passions. And the best place to find me is probably on LinkedIn. And you'll find some of my thoughts and opinions and sharings there. And, you know, it's hard not to find me at most of these meetings, too. I'm the one walking behind Andy in great awe.
Yeah, right. Thank you so much for being here. Guys, thanks for tuning in, everybody. Take care of yourselves. And that's what I got for you guys. I hope you enjoyed it. I hope you got something out of it. Thanks to Peter for being with me. I always enjoy kicking ideas around with him. It always affects my thinking. I'm going to definitely have to meditate on this episode a little bit for a while. I think there's a lot here. So anyway, guys, take care of yourselves. Be well. I'll talk to you soon. Bye.